So welcome everyone. Thank you for joining us at the Young Professionals Learning Community. We're going to be talking about overdose prevention and response today. Just a quick disclaimer that this presentation was prepared for the Pacific Southwest Mental Health Technology Transfer Center under a cooperative agreement from the Substance Abuse and Mental Health Services Administration.
With that, we're going to roll into the next bit. We have now the risks of opioid overdose. So drugs taken together can interact in ways that increase their overall effect. But let me roll through this points here. So using drugs alone or being left alone is a really big risk for an opioid overdose. Oftentimes what happens is, say someone has Narcan on them, right? They have Narcan, they say, I have Narcan, I'm being safe. Potentially they use the substances. And if they go through an overdose, they forget that they won't be able to administer it on themselves. So it can, using it alone can be difficult because there's no one there to know that an overdose is being occurred and do something about it. Using too much of a drug or drugs can be a bad concoction because they can sometimes interact in ways that might increase their overall effect. Many overdoses occur when people mix heroin or prescription opioids with alcohol or benzodiazepines, and that can be things like Klonopin, Valium, Xanax. Right, most fatal overdoses are a result of poly drug use. The quality of the drugs being used, right, that can increase or decrease their potency depending on how refined or unrefined or well made or maintained these things are. Like we mentioned, right, mixing and amounts of what we are mixing can have an effect on there. Reduced tolerance after a period of abstinence. What happens is maybe you go into medication-assisted treatment, or you cut clean, or you do anything like that, and you have, what they refer to as a relapse. And what happens is you think back to the last time you did it, where you had a really high tolerance, you up the dosage a bit more, but your body is no longer used to that amount, and it sends you straight into an overdose just because of the sheer amount you are using, and your body is no longer able to handle that. Age and physical health have a big bearing on this, right? Younger, older, if you have medical history that's with a bunch of things, you're not anything at all of that. Like we know, drugs affect people in many different ways. The mode of administration, if it was orally, if it was via the bloodstream, right? Different kinds of ways that you can use these things, that does have an effect on how it gets processed through the body. Like an allergy, right? A previous non-fatal overdose can potentially increase the effect of the next overdose. Something that a lot of people don't keep in mind or don't think about is that actually having a previous overdose does have an effect on if you will have another one. And there are a few things that aren't on screen for you all to see, but there are things like speedballing, right? Mixing things like heroin and cocaine, another common drug combination. While it seems intuitive, right, that a stimulant and a depressant could counterbalance different effects, the combination does not cancel out the overdose risk. And there's actually people who do that are at a higher risk for overdose than people who use one or the other. The body has to process more drugs, right? The stimulant causes the body to use more oxygen, while the depressant reduces the breathing rate, right? We talked about how opiates reduce and has that effect on breathing and are true or false. And then people who speedball usually inject more frequently with less time between the shots, rather than people who only use heroin, as an example. So some risks there on screen. With that, there are strategies that you can share with youth about reducing the risk of overdose. So not using drugs alone can be a big one. And again, when we're working with this, we're working with two contexts. The context of harm reduction, right? The context of we are meeting the youth where they are, understand that there might be a larger story than just them using this substance. Maybe they need it right now, maybe all of these things, right? So we can work with them to not use it alone to reduce that harm. And then of course, we're in the context of substances. We're working with opiates mostly here, but keep in mind, there are other kinds of overdoses. You want to help youth make arrangements with someone to be with them, or even just to check in on them, and that can provide a massive boost to their essentially their survivability rate if they do go into an overdose. Somebody knows, they can alert EMS, they can use Narcan, whatever it might be. Don't mix drugs, especially it's opiates and alcohol and benzodiazepine, right? If you are mixing, again, harm reduction context, do opiates first to better gauge your intoxication. Alcohol and especially benzos impair judgment so that you may not remember or care how much has been used. And last, but certainly not least, be aware of reduced tolerance after a period of abstinence or less use. If you're going to do it, you want to go slow and you want to potentially start with a tester first. We are working within the realm of harm reduction, right? These things are not to tell them, don't ever use them, because as we know in life, things happen. So this is what we can work with the youth on to help increase their chances, have them survive, to make it to the point where they can potentially stop themselves from using substances. It's not just tolerance when you're constantly using it, but it can also be if you're sick, if you have cold, if you're ill, if COVID, whatever it might be, can also have an effect on that tolerance. Keep that in mind. Using a different method, right? Snorting versus injecting, all of these things have an effect on that. Be careful when switching from one type of opiate to another type of opiate, right? These interactions can be very weird, and potency and all of that. Really, it's hard to tell if you don't know specifically. Test the strength of a drug before doing a larger amount. And then last is develop an overdose plan with your friends or partners. So if worst case scenarios, if you're going to use, if it can't be avoided, then you know what? We should have a plan in place to help potentially save a life if it does happen. And that's really what we're looking to do, to save lives here. Do any of the risk reduction strategies that we just discussed make you uncomfortable? And if so, why?
I think you mentioned something about like Narcan and always having it on hand. I was just wondering, I guess is there like a specific training that you need for Narcan?
You do not need a training to use Narcan. You simply just, you don't need a training. You can just have it on your person and do it. I recommend taking a training if you can. I used to facilitate trainings back when I was a training coordinator. But Narcan is a fairly simple process. You essentially take it out of its container, put it into the nostril and spritz, and you're pretty much good to go. Now, there's more to it than that, but you'll go through that in the training, but it is, as far as I know, not required at all.
Yeah, and really good news too. I mean, each state has obviously different laws and different practices, but in theory, you should be able to purchase Narcan over the counter at a pharmacy. It used to be that you needed a doctor's prescription. It was pretty hard to get your hands on, but there has been legislation at the federal level because we have seen such a jump. Particularly, I was just reading that last year was like the highest overdose rate like we've ever had. Like I think it said something like 100,000 people died last year during the pandemic. And so there has been legislation. So in theory, you should be able to go right to the pharmacy and buy Narcan, even if you are not actively working with youth who have substance use disorder, or even if you do not have friends or family who are struggling with substance use, and particularly opioid use disorder. It's still beneficial to have, because true story, like 3 years ago, I was at the river here in Oregon, and it's like, it was a really rural spot. Like you have to drive probably 45 minutes from the city. And then you have to hike in about 1.5 miles to even get to the river. And a young woman overdosed at the river. And it took a really long time for paramedics to be able to get there. So I don't know what happened to her. She was still she was cyanotic, so she's blue. We were doing chest compressions, and we were able to, thankfully, there was service and we could call 911. But had one of us had Narcan on us, we could have potentially helped her a lot more, because even if she survived, there is great risk of having brain damage from not having enough oxygen to your brain. So you definitely recommend carrying Narcan with you. You never know when a stranger might need some support, or so, a youth that you work with, or, you're a grad student, could be even, a student. So definitely recommend heading to the pharmacy. And there are a few slides later on where I do actually talk about Narcan and naloxone. If someone is really high and using downers like heroin, or pills like OxyContin or Vicodin, you will notice that their pupils will contract and appear small, that their muscles get kind of slack and droopy, right? They might do what's called nodding out. So kind of just like, I'm sure you've maybe even seen it in your community, where they just kind of, your head just really like literally nods out and you kind of look like you're falling asleep. And they might scratch a lot. Opiates make your skin quite itchy. So you might notice that is happening. Their speech may be slurred, because again, it's a depressant. So it affects your, nervous system in that way. And they might just be generally out of it, but they will, if they're not overdosing, respond to outside stimuli like loud noise or a light shake from a friend or someone calling their name. So, if they're still able to kind of be stimulated by something, they're probably okay. That said, if you're worried that someone is too high, it's super important that you not leave them alone for all the reasons that Josh just shared, right? If the person is still conscious, try to walk them around, keep them awake, and really monitor their breathing. So sometimes it can be difficult to tell if a person is just very high or if they're experiencing an overdose. If you're worried, again, that someone is getting too high, like I just said on the previous slide, don't leave them alone under any circumstances. So some of the signs of overdose include a loss of consciousness, being unresponsive to outside stimulus, awake but unable to talk. Their breathing will be very slow and shallow. It'll be erratic, or it may stop entirely, which is like the danger zone. For lighter skinned folks, the skin tone turns sort of like a bluish purple. For darker skinned people, it turns grayish or kind of ashen. As I just mentioned about the story about the young woman at the river, like she was what we call cyanotic, right? She was blue in her lips and in her fingertips. You also might hear choking sounds or kind of a gurgling noise. Sometimes that's called the death rattle. They may begin vomiting. If your breathing doesn't totally shut down, you may choke, right? If you're not in an appropriate position. The body will be very limp. The face will be kind of pale and clammy. Again, the fingernails and lips turn blue or kind of that purplish black, depending on your skin tone. And your pulse or heartbeat is, slow, erratic, or not there at all. If you're with someone and they're making unfamiliar sounds while, sleeping, who's been using opiates, it's really worth it to try to wake them up, right? It's really rare for someone to die immediately from an overdose. And when people survive, it's because someone was there to support them and help them. So if you're having a hard time telling the difference between someone being high or experiencing, it's always best to treat the situation like an overdose, right? Like always err on the side of caution. Your friend, your family, the youth you work with might get pissed off at you, but that's okay, because it's better to be on the safe side when it comes to using opiates. It's rare for someone to die immediately from overdose. It's usually a kind of slowish process that takes anywhere from a few minutes to up to a few hours. And when people survive, it's because someone was there to respond. If someone's overdosing, they will be not breathing, they will be unresponsive. And so these are some of the immediate steps you want to take in the event of an opioid overdose. You're going to want to stimulate them awake by yelling their name and administering a hard sternum rub to the chest plate. So like, and when I say hard, I mean use like your knuckles, right? Like really try to stimulate them. you're going to want to, if you have naloxone, Narcan, use it, right? That's immediately after. It's a life-saving medication. It counters the effects of opioid overdose. And it's available, as Josh said, both as a nasal spray, and it's also available as an injectable. The stuff you get over the counter is the nasal spray, and it's quite intuitive to use. And with the injectable, you know, you're going to draw up the entire vial and you would inject it into the thigh muscle. So it's like you really have to get in there. For the nasal, you're going to stick the device, as Josh said, all the way up one nostril, click the plunger, and make sure that the device is, inserted fully, and the medication will absorb through. The second step, if you don't have Narcan on you, is call 911 and explain someone is not responsive and not breathing. I'll talk a little bit more about it, but you don't want to necessarily say overdose, but really say they're not breathing and they're not responsive, because then the EMS will have a real sense of urgency that they need to get there right away. Step 4 is you're going to want to provide rescue breathing, so get the person on their back, tip their head back to straighten the airway, pinch their nose, put your mouth over theirs, and form a seal with one breath every 5 seconds. When the person starts to breathe regularly on their own, you're going to want to roll them into the recovery position on their side. Again, as I mentioned, we don't want them lying on their back, because if they vomit, they could choke, or even aspirate, where you get vomit into your lungs, right, and get pneumonia. And then finally, this last step is being gentle with them and yourself. And sort of the assessment and stimulation, like if you're unsure if the person's overdosing, the obvious signs you can assess are: is the person breathing? Is the person responsive? Do they answer when you shake and shout their name? Can they speak? And how's their skin color? So just wanting to reiterate that over and over. If the person's unconscious or in a heavy nod, as I said, the first step is try to stimulate them awake through verbal and or physical stimulation. So, call their name, or say something they might not hear, right? Like, I'm going to call you 911, or I'm going to give you Narcan. They may not want that to happen. So, say something that will get their attention. If that doesn't work, try to stimulate them with kind of pain, right? Like, not too much, but enough that it would, jolt someone to wake them up. So, rub your knuckles into the sternum, the place in the middle of your chest where your ribs meet. On their upper lip, you can rub your knuckles, or pinch the back of their arm or something, just something that would, again, like jolt someone awake. And if this causes the person to wake up and you're successful with that stimulation, try to get them to focus, and can they speak to you? Check their breathing. If it's shallow, or the person tells you they have shortness of breath or chest tightness, you're going to want to call 911. And you're going to want to continue to monitor them, especially the breathing and pulse, and try to keep them awake and alert. If the person does not respond to stimulation and remains unconscious, or the condition appears to get worse, do not try a different alternative form of stimulation. Treat it as an emergency and administer Narcan or call for help. Naloxone or Narcan only works if there's opioids involved with the overdose. It cannot reverse an overdose of cocaine or speed or benzodiazepines or alcohol or other non-opioid-based drugs. But the first thing here when you're administered is you're gonna do rescue breathing for a few quick breaths, right? If the person's not breathing, then you would affix the nasal atomizer, the applicator, to the needleless syringe, and then assemble the glass cartridge of naloxone. In some cases, like the ones you can often, like Narcan that you buy over the counter, the applicators will be pre-assembled. Tilt the head back, and you'll spray the half of naloxone up one side of the nose and half up the other side of the nose. If there's no breathing, or breathing continues to be shallow, continue to perform rescue breathing for them while waiting for the naloxone to take effect. If there's no change within like 3 to 5 minutes, administer another dose of Narcan if you have it, and continue to kind of manually breathe for them. And if the second dose of Narcan does not revive them, something else is wrong. So it's either been too long and the heart has already stopped, or maybe there aren't opioids in their system, or the opioids are unusually strong and require more than Narcan. So that can happen with fentanyl, for example. Injectable naloxone comes packaged in several different forms. You can get a multi-dose vial, a single-dose vial, flip-top vials with a pop-off top. With all formulations of naloxone, it's just important to check the expiration date, right? And make sure to keep it from light if it's not being stored in a box. If someone has an injectable formulation of naloxone, all the steps in recognizing and responding to overdose are the same, except how you would administer the naloxone. And to use the injectable naloxone, again, you start with that rescue breathing for a few quick breaths if the person is not breathing. You're going to want to use a long needle, like 1 to 1.5 inches. That's often called an intramuscular needle. And needle exchange programs and pharmacies have these. You're going to want to pop off the orange top vial. You're going to draw up 1 cc of naloxone into the syringe. You're going to inject into a muscle, thighs, upper, outer quadrant of the butt, or shoulder are best. Inject straight in and deeply, so you hit the muscle. And if there isn't a big needle available to you, a smaller one is okay, and you can inject under the skin, but if possible, it's better to get it into the muscle. It's going to work more effectively. After injection, continue that rescue breathing for 2 to 3 minutes. And same as I said before, if there's no change within a couple of minutes, you're going to want to administer another dose and continue to breathe for them. And if the second dose doesn't revive them, just as I said a moment ago, something else is wrong and you need to call 911 immediately. Once Narcan has been delivered, if the person is not able to breathe for themselves, that continued rescue breathing is really important until help is able to arrive. And interestingly, like naloxone only lasts between 30 to 90 minutes. It depends on the weight of the person and all that stuff. While the effects of opioids may last much longer. So it is possible that after the naloxone wears off, an overdose could recur. So it's important that someone stay with the person and wait out the risk period, just in case for, God forbid, another dose of naloxone is necessary. Also, just like a quick side note, Narcan can cause some uncomfortable withdrawal feelings, right? It's like reversing the effects of the opiate. So, it blocks the action of opioids in the brain. So sometimes people will want to immediately use again to stop the kind of uncomfortable withdrawal feelings. If they do that, that could result, of course, in another overdose. So really try to be supportive to a person and encourage them not to use drugs for at least a few more hours. It's recommended, obviously, that you call 911 in case of an overdose, because it's important to have trained medical professionals assess the condition of the overdosing person. The overdose, there may be other health problems going on. Also, people who survive any type of overdose are at risk of experiencing other health complications as a result of the overdose, such as pneumonia, heart problems. So getting someone checked out by a medical professional is an important part of reducing the harms associated with overdosing. So what you say to 911 when you call 911 depends on local emergency responses to overdose. In every community, it's important to report that the person's not breathing, or that their breathing has slowed or stopped, that they are unresponsive, and give the exact location of where you are. So be as, and if you did administer naloxone and it tell them it didn't work, right? So in many communities, right, the police might respond along with ambulance calls to 911. So in some communities, when the police respond, they don't arrest a bystander or victim at the scene of an overdose. However, in other places, they might. and have been known to charge folks with, everything from drug possession to manslaughter if the overdosing person dies and the bystander is proven to have provided the drugs. And so the fear of arrest and police involvement are substantial. Agencies and you all should really try to learn from participants what the real risk is and work with your local police departments and emergency personnel to address the fear of arrest and police involvement. I'm sure, there's some communities and some states that have laws that protect you, and they're, like Good Samaritan laws, so that you can't be arrested, but other places don't. So just being aware of what your local community has in place. And if you don't have Good Samaritan laws that protect folks, that can be a real policy advocacy thing you can do, because a lot of the fear of arrest can prevent people from calling 911, which is unfortunate. So when making the call, you're going to want to tell the dispatcher exactly where you and the overdosing person are. So give them as much information as possible so that they can find you. So be very specific. I'm on the 3rd floor in the bathroom. As much detail as you can provide so you can save them time and they're not trying to search for you. You're going to want to avoid using words like drugs or overdose. Just stick to what you see. Not breathing, turning blue, unconscious, non-responsive. That makes the call a priority. When the paramedics arrive, tell them what you know about what drugs the person may have been using. So as much information as possible. If the paramedics suspect opioids, they will give the victim an injection or intranasal dose of naloxone, whether or not you have. And you're going to want to, depending on, telling young people too that you're working with, keep the loud noises in the background to a minimum. If it sounds chaotic, they may dispatch police to secure the scene. So step 4, you're going to want to perform rescue breathing. So for a person whose breathing is severely impaired, rescue breathing or chest compression is one of the most important steps in preventing an overdose death. When someone has extremely shallow and intermittent breathing, so around 1 breath every 5 to 10 seconds, or has stopped breathing and is unresponsive, rescue breathing should be done as soon as possible because it's the quickest way to get oxygen into someone who has stopped breathing. If you're performing rescue breathing, you are getting much needed air into somebody's body who will die without it. The difference between survival and death in an opioid overdose depends on how quickly enough oxygen gets into that person's body. So the steps for rescue breathing are to place the person on their back, tilt their chin up to open up the airway, check to see if there's anything in their mouth blocking their airway. So things like gum, if they were chewing gum, if there's any kind of undissolved pills or a syringe cap, definitely check for like a fentanyl patch, which sometimes people will cheek. And if you find anything, remove it, obviously. You're then going to want to plug their nose with one hand and give 2 even regular sized breaths and really blow enough air into their lungs to make their chest rise. If you don't see their chest rise out of the corner of your eye, tilt the head back more and really make sure that you're plugging their nose. And then breathe again. And you're going to want to give 1 breath every 5 seconds. You may have heard that recent CPR guidelines recommend hands-only CPR, they say you don't have to do mouth-to-mouth anymore. But those guidelines are for a layperson response to cardiac arrest and not to overdose. It's still recommended that you perform rescue breathing for an overdose where the primary issue is respiratory depression and not cardiac arrest. If you are alone with the overdosing person, follow these steps and give the person a few breaths and then put them in the recovery position that I referenced earlier, kind of putting them to their sides. And then if you have Narcan, that's when you're going to want to go get that. If there's more than one person in the room, divide responsibility, divide and conquer, right? Have one of you do rescue breathing while the other one goes and gets the Narcan kit. And if you don't have a Narcan kit, continue that rescue breathing again until help is able to arrive. And if there's more than one person present, take turns doing rescue breathing. It can be really exhausting. That place into recovery position. So lay the person slightly on their side. You're going to want to bend their knee, turn their face to the side, and then that will keep the airway clear and prevent them from choking on their own vomit. And finally, and I'm so sorry, I just realized we're a little over time. Because naloxone blocks opioids from acting, it's possible, as I said, that they're going to have withdrawal symptoms if someone has a daily habit or opioid tolerance. So after giving Narcan, they may feel what's called dope sick, and they might want to use right away. So really encourage them not to do that. That's how re-overdose happens. Be gentle with them, be gentle with yourself. Like, it's a really stressful situation to be put in for all parties involved. Thank you so much for joining us today.